It appears the flu is back, my friends. Well, the flu kind of went away during COVID and we didn't hear much about it in 2021, 2022, or 2023, but we heard a little bit about influenza last year, but it seems that the flu is back and influenza-associated deaths have surpassed COVID-19 deaths this cold and flu season for the first time since the COVID outbreak. So I have some thoughts about this. I want to share with you some statistics and sort of dive into this because it's interesting. We didn't really hear much about the flu. And although people are dying from the flu, no one is suggesting that we close schools, close gyms, leave fast food restaurants, of course, open, and liquor stores open. Now, jokes aside, let's talk about this. There's a lot of talk about this quaddemic. This was published in Newsweek just several hours ago. Patients warned over quaddemic of COVID, flu, norovirus, and RSV. Let's see what this article has to say. The United States is fighting a quaddemic this winter with 4 major viruses: COVID-19, influenza, respiratory syncytial virus, also known as RSV, and norovirus, with infants at particular risk. And actually, this is where I want to share with you this statistic from the CDC. Now, as you can see here on the x-axis, this is weeks during the year. And on the y-axis, this is percent of visits for influenza-like illness during this cold and flu season. So who is being impacted by this? Well, it's mostly young children. And so that suggests that anytime you see young children from a epidemiological standpoint getting impacted disproportionately compared to elderly or older people, that suggests that the pathogen is endemic. And we actually saw that pivot throughout the COVID-19 outbreak. Remember, children were actually largely spared from COVID. It was mostly elderly people who were impacted early on. And as the virus became more and more endemic, it started to impact children, which sounds sort of sad and morbid to say, but that's actually a good thing because that means that most other people have seen the virus before, except for young children under the age of 0 to 4. They don't have a lot of immunity built up to this particular influenza that seems to be a type A subtype. This is the H1N1 predominant, as well as the H3N2, which is a subtype of the A strain of the influenza strain. And so you're seeing here just a surge in influenza. And I think the question is sort of why. What I really wanted to look for is an association between status of the thing, how many people got the thing, and if there was an association between prevalence of subjects who got that and incidence of influenza activity. But it doesn't appear that we see that, and I would be very curious to see if there's any data to show that. When we look here at high or very high influenza-like infectious activity, what do you see? You see Washington and Oregon is off the charts. You also see Texas is really high. You see Florida. You see New York is particularly high. It's kind of curious. Montana seems to be minimal. Hawaii seems to be minimal, the Virgin Islands. But then you also look at the Midwest. It seems like the Midwest is getting hammered by the flu. Now, you could look at this and see there's not really a super strong association between latitude, because we know that vitamin D right now levels, particularly for people living in the northern parts of the country, is going to be quite low. It seems to be more concentrated around very dense metropolitan areas. The Dakotas, not really high in influenza-like activity. I mean, higher than, say, Montana, but these states are really sparsely populated. Wyoming, pretty low activity, again, sparsely populated. So it seems to be a more concentration specific, but it would be interesting to look at more granular data, vitamin D status, how many boosters someone has gotten. I mean, that would be really interesting, because we heard and saw preliminary research to show that there is sort of an immune exhaustion phenomenon going on with people that have gotten recurrent immunizations for the big bad pathogen. I would love to know what you think in the comment section below. Part of the reason why I make these videos is to learn from you as well. I personally haven't gotten sick in several years, but the people that I know who have gotten the flu recently, it's anecdotal, but it seems that they have sort of drank the Kool-Aid. So I would like to know what you think in the comment section below, my friends. But what I do sort of want to address shortly, talk about vitamin D, but also talk about how this is actually a good thing. Because again, for a while, the predominant virus was COVID. And that's because it had a higher lethality and a higher ability to outcompete in the ecological niche compared to influenza. And now that we're seeing influenza come back, that means that COVID is even more and more benign. And that's the good thing. So we saw there was an inverse association here because some people got a co-infection of influenza and SARS-CoV-2, but that was more rare. You generally saw this ecological competition, and it seems that influenza is outcompeting COVID, which I think is probably a better thing. Why might I say that? Well, it's because influenza has been circulating for a very long time. SARS-CoV-2 is more new. There was probably some gain of function stuff going on. If you're going to pick one pathogen to get infected by, probably influenza because it hasn't been manipulated in a laboratory type setting. Still, you want to consider things like vitamin D, exercise, N-acetylcysteine and glutathione support, all those things I can put in the link in the description below as ways to improve immunologic health. Iodine, really important here. But as you can see here, influenza positive tests as reported to the CDC by U.S. clinical laboratories, this is off the charts. This is in thousands, but I did read somewhere else that at least 30 million people have tested positive for influenza recently, which is really high. You think we live in a country of 330 million. So, roughly 10% at least of our population has been tested positive for the flu. Now, this is where we could do really fast research, to see like, hey, how many patients who have gotten the flu have also gotten the Tamiflu or immunization for that. I mean, this would be really great data. And because RFK has now been, sworn in as our new Health and Human Services Secretary, I think this research would be fascinating to know. It's like we could really test in real time to see without, taking away the industry influence and the regulatory bodies that are designed to, oversee, say, the pharmaceutical industry. It'd be like, hey, let's look at the granular data. It'd be a simple question. Have you gotten a flu thingy? Because we're on YouTube, we can't really talk about it. And see, if someone tests positive versus not. I know many people who haven't gotten the flu shot in like decades and they never get the flu. This would be really good data. So hopefully RFK we'll be looking at this. I would love to know what your thoughts are, my friends. I mean, it seems that, by the time research comes out, it'll be 2 years down the road, and it doesn't help us right now. It'd be cool in real time if we could all just log into Apple Health and just be like, haven't gotten the flu, haven't gotten the thingy for the flu. And then we could see millions of people in real time share that data so that we could really have good evidence to know what's going on. So now, even more interesting in this article in Newsweek, they say, why are these viruses surging now? This is interesting. Let's see what they say. The reason this year we are seeing more aggressive outbreaks is really a perfect storm of circumstances, Fulton told Newsweek. Throughout the pandemic, we had an interruption in the normal course of circulation of flu and RSV. So some people, especially little kids, haven't built up the same degree of protection they normally would have in normal times. And then add insult to injury, these viruses are behaving unpredictably post-pandemic with shifts in seasonality and severity. In addition, Fulton explains, vaccination levels against flu and RSV have been lower than hoped, which had compromised community immunity. Add in more social mixing and fewer protections like masking and distancing, and these viruses are circulating more freely. So I guess there's several questions here. If more people are dying from influenza compared to COVID, why haven't health experts said we should close schools again and lock everyone down? I mean, it's really like, remember in COVID, like when you didn't wear a mask at the grocery store, it was like you essentially were characterized as wanting people to die. You were a murderous person. But if we don't wear a mask now, yet more people are dying from the flu than COVID, why aren't we still, where's the fervor? Where's the excitement here? I think that's point number one. Point number two is I would be willing to bet money that some of the people that are getting severely ill from influenza have non-communicable diseases like high blood pressure, diabetes, obesity, and things that are worse now. Their state of health is at a worse place post-pandemic than it was before. And that's part of the reason why we're seeing so many people get really sick, is because obesity rates have increased, metabolic disease has increased. We've relegated kids to smartphones and online schooling and sports have been on the decline and all that. So I don't know. I'm just looking for some logical consistency. I would love to know what you think in the comment section, my friends. Let me know. It's interesting. I follow a lot of emergency room physicians on Instagram, and this is all they can talk about is the flu right now. So I don't know. It's sort of interesting. Let me know what you think in the comment section below. And if you want immunologic support, especially vitamin D and A together seem to work better than either one alone. So if you want a really great form of D3, K2 along with vitamin A, click the link in the description below. You can save over at myoscience.com on that. But let me know in the comment section below if you know people that are sick with the flu, and if you've linked any associations or commonalities with their lifestyle and nutrition. Let me know, because everyone learns from comments like you. So we'll catch you on a future one down the road.